Hi everyone, hope you're doing well. My name is Duncan Goldie and welcome to Spill the Beans podcast. My guest this week is Caroline Gadd, who is the founder of OHS, which is Otsuka Health Solutions. Caroline has had a lot of experience within kind of digital innovation. She's worked as a director of value and access for a GSK company called Stifle. She was head of healthcare marketing at Abbott Laboratories, and she got a role with Otsuka Pharmaceuticals, who are a huge multinational, as director of market access, and then spotted an opportunity to be able to create a subsidiary company called Otsuka Health Solutions, which focuses on mental health solutions for patients. So it's really, really important, and she's received some great traction with the product as well. She's currently an NIA fellow, so for any of you who are following the NHS Innovation Accelerator, you will already know who Caroline is, but you might not know the background or the full story behind her or OHS. So it's a really in-depth and interesting conversation that I had with her, so really hope you guys enjoy it. Caroline, hi. Thank you so much for taking part in the podcast with me today. How are you? Tell me, whereabouts in the world are you right now?
Hi, Duncan. Thanks for having me. So I'm here in Christchurch, which is near Bournemouth on the south coast, in my home.
Lovely, lovely. I used to live in Bournemouth. I know Christchurch well, so very nice part of the world. Are you managing to get down onto the beach much during the pandemic?
Yeah, I'm so fortunate because we're only about a 10-minute walk from the beach, so it's been fantastic to be able to go down there over the weekends and after work. So yeah,
exactly. Lovely. Bournemouth Pier, kind of, and Boscombe Pier as well. I know that well. Yeah. How's the working from home situation for you? Have you been? Has it changed much? Were you working from home prior to this?
Yeah, so I previously would have spent maybe one day a week working from home. So it is a real change for me, spending, well, now 4 days a week, but during the lockdown, 5 days a week working from home. I think me and my team, we've been able to adapt quite easily to working from home because the NHS has been so good about being flexible. So it's worked quite well. So now I can fit in many more discussions with NHS clients than I could have done previously when I was travelling all around the country to see them face to face. Although I do miss being able to go onto sites and talk face to face with health professionals and kind of absorb some of the work they're doing, which really helps us to respond to it.
Yeah, absolutely, absolutely, and we'll get into that, a lot more in a second. Obviously, the good work that you're doing with Otsuka Health Solutions. So, just to go back to the kind of start of your career, can you talk me through a kind of bit of a career path and what led you up to found OHS?
Yeah, so I'm a nurse by profession, actually a children's nurse, and I started off my career working in Bristol doing children's bone marrow transplants, which was really fantastic, fascinating work. And I guess as a result of many personal changes, I ended up taking a bit of a career change, and it initially started working for Nutricia, selling baby milk in my early career, which then progressed on to other healthcare roles, working in pharmaceuticals particularly. And I became really interested in how commercial organisations would collaborate with the NHS to get a really good result for both. So each of the organisations I've worked with, my role has really been focused on trying to find different innovative ways of working together, partnerships that are going to deliver really good patient outcomes and are good for all parties. So it's been a consistent theme through my career, and I've had the opportunity a couple of times to lead projects with the NHS where we've developed digital solutions that respond to a particular need. The first opportunity was actually in diabetes and cardiometabolic disorders, where I worked on a data-driven solution with GPs to help them to better manage their cardiometabolic patients in a primary care setting. And then when with Otsuka, an opportunity came up where to lead a brand new R&D project, looking at whether Otsuka could start to help the NHS and other healthcare organisations across the world to improve mental health care by providing digital solutions. So really that led to the founding of OHS around 6 years ago. But back then it was really kind of me starting to kick off this project as in addition to my regular day job. And it kicked off with a really exciting and creative partnership with a mental health trust here in the UK. And that was the beginning of OHS.
Wow, fantastic. So obviously Otsuka Europe is obviously quite a big established organization, and I believe the parent company of OHS. How are you kind of differentiating between the two and keeping them separate?
Okay, yeah, so it's a really important point. And the first thing we learned when we entered into our collaboration with the Mental Health Trust was that actually, in order to be really helpful and really deeply understand the needs of the mental health system, what we needed to do was actually move in with them and embed ourselves within that organisation so that we could really start to problem solve with digital solutions. And that meant that we had access to a lot of confidential and sensitive information. So at that point, we realised that we needed to put a firewall up between OHS and Otsuka as a parent organisation. So since that day, we've operated as a fairly independent subsidiary. Information that's within OHS and the OHS team is kept completely confidential from the broader organisation, and that's obviously patient sensitive information, but also just NHS commercially sensitive information that we're party to. So even to the extent where the regulatory requirements around our OHS business are purely for OHS. So for example, our information governance toolkit that we complete every year to enable us to work with the NHS is just about OHS, not the broader organisation, as is our kind of our other information security accreditations.
Yeah, definitely. And you mentioned there a couple of important pieces of work that you've been doing kind of since the outset, embedding yourselves into key organisations. Can you talk me through kind of more about how OHS works and integrates itself and the types of digital solutions that you're providing?
Yeah, so well, when we were working in Bristol on our R&D project, we really spent, as I said, these 2 years embedded in the system. And at the end of those 2 years, we found that we had been able to create a solution which responded to specific challenges in community mental health services. And those challenges were common to community mental health services across the country. So what they were seeing is rising caseloads, a declining number of mental health nurses, which meant that there was real pressure on individual professionals and real pressure on the system. So people in community mental health services actually had quite high risk and complex mental health conditions, were likely to need some kind of either hospital or crisis care in the community at some point during that pathway in the service. But really the teams were struggling to cope with those caseloads. So people would stay in the caseload for a long time rather than recovering and being able to return to a more appropriate service, perhaps in primary care. I guess the landmark project that we've completed in response to these challenges actually has been implemented with Merseycare as part of their Global Digital Exemplar project. And what we have been able to deliver is a predictive algorithm which helps community mental health teams to understand who are the people who are most likely to need to use crisis services in the next 28 days, right through to who are the people who are least likely to, who might benefit from a slightly different service from the one they offer. So that stratification then feeds into a decision support tool, which we call MAST. And MAST is used by frontline staff, and it was designed by frontline staff in order to help them better manage their caseloads, make better decisions about the people that they're caring for, and have all the information they need in one place to be able to make those insightful decisions. And that's really taken the pressure off those services, both at an individual practitioner level, but also at a system level. So in Merseycare, we've kind of seen caseloads decline, a reduced number of people needing to be admitted to hospital in crisis. We've seen just improved quality and safety within services, which, you know, has just been fantastic and exciting to be a part of, when you can see the direct impact of the work we're doing as part of their transformation on patient outcomes.
Yeah, absolutely. And I guess, you know, in terms of the whole healthcare industry and landscape, so much in 2020, but also prior to this, you know, there was lots of different industries and sub-industries within the healthcare economy that were, you know, overloaded, overworked and under-resourced. And so, you know, allowing people to sort of, or allowing practitioners to sort of focus their time on the ones who need it the most within those kind of clinical environments is so important. And I mentioned obviously 2020 is obviously a huge you know, emphasis and kind of escalation of that due to the COVID pandemic. I mean, have you been kind of directly impacted through that with OHS and your kind of service offering? Have you tailored it towards more of a COVID response?
Yeah, we have been impacted, you know, both in a positive and a less positive way. So at the beginning of 2020, just before the pandemic, I was selected to be a fellow on the NHS Innovation Accelerator programme, which, you know, was just a real kind of milestone in our journey, and really exciting. And the programme is designed to support the scale up of products like MAST within the NHS. So what the idea is that, you know, I would be speaking at many NHS conferences around the country, and sharing our experiences and visiting lots of mental health trusts and enabling the scale up of MAST in those trusts. And of course, actually it was only days after the launch of the NIA programme that the lockdown was announced. And the NIA have been fantastic in terms of transferring a lot of those opportunities into online opportunities like, you know, webinars and podcasts. So we've had to be flexible in that way, which has been positive. Actually, some of the scale up opportunities we had early in the year haven't progressed with MAST, simply because trusts have really just had to throw all their attention into dealing with the pandemic quite rightly. So many haven't progressed, and that's been challenging. But what we have done is we've had the opportunity to see how we can adapt MAST to respond during the pandemic. And specifically working in collaboration with Merseycare, we've created a version of MAST which helps mental health organisations to find people in their caseloads who also are vulnerable because of their physical health condition or their social vulnerabilities. Perhaps they're on the shielded patient list, or they have a family member on the shielded patient list, and really connect with those individuals during the lockdown to make sure that they're safe and they have the right level of care in place, even though they may not be receiving face-to-face care during that time. So this was really the first time that MAST had brought together information from the physical health record as well as the mental health and social care record, and in a way that enabled the staff in Merseycare to contact over 8,000 people during the first 6 weeks of lockdown to make sure they were safe and put the right plan of care in place. And what they discovered when they made the telephone assessments was that some people were actually really suffering in terms of their mental health. Some even had some suicidal thoughts, and they were able to put urgent and proactive plans in place to help support those individuals. So many were very, very grateful of the support and just felt that they were on the radar of services, and that had a protective effect for those individuals. So we continue to now offer the masked COVID-19 version alongside the core mask product, and trusts like Greater Manchester Mental Health, for example, are scaling up to offer both products to make sure that they're addressing the needs of the communities they serve.
Yeah, fantastic. And do you think that post-pandemic, if we ever can get into a situation where we're confident enough to call it post-pandemic, that you'll take some of the learnings that you've had throughout the COVID time and kind of re-strategize or reforecast the direction that the product was going in, or the services that you were going to offer? Or do you think that you'll go back, and that's probably more so from a kind of operational level, from the actual work that you're doing through to the actual, care pathways that you're providing?
Yeah, I mean, we're already doing it. So at the moment, many community mental health teams are midway through or embarking on a transformation, and that's the implementation of the community mental health framework as part of the long-term plan. So the direction of travel with community mental health services, they'll become much more integrated with physical health services. They'll be offered with a neighbourhood focus, serving the needs of communities and making sure that they're addressing the needs of communities with specific issues, and MAST will respond to that. So we are looking to integrate information from physical health teams as routine, but also offering analytics which will help trusts to identify communities in greatest need and respond to those challenges. So really what MAST will do over the next several years is be a kind of digital enabler of that community transformation, so that no matter how the service is structured, there'll be a central repository of data insight, which will mean that teams can make the best decisions using the data that they have.
Fantastic. Well, yeah, I mean, it's obviously that access to healthcare, particularly for those who are most vulnerable with mental health conditions, has been overlooked for such a long time. So it's a long overdue solution, but such a fantastic one as well, that, it's great to be able to see that traction that you're getting as well. I mean, talk to me just briefly a little bit more about the people that you have within the organization and the kind of journey that you've come on. I mean, how many people do you have supporting you on a full-time basis, working directly with OHS at the moment?
So we're a small team, so there's 5 of us within the OHS team, me and a program manager and a clinician and 2 analysts. So we hope to be able to grow as we scale up across new trusts, but we're also supported by a technology partner, Earthware, who are a UK-based digital agency, and they help with the development of the front-end software. So we complete the analytics in-house, and then Earthware are our partner organisation. But really, the greatest partner that we have in the development of the products is the NHS itself, and in particular this long-term collaboration we have in place with Merseycare and North West Boroughs Trusts, where we're continuously trying to respond to the evolving situation together and design solutions and evolve the MAST solution in a way that where staff and people who use services are involved in that.
Yeah, fantastic. And have you had much feedback from the actual NHS practitioners themselves on the platform?
Yeah, well, the great thing is that we're able to talk to them the whole time about this. We feel like we're kind of part of their team, so it is really positive. Many staff have talked about how they were trying to solve the problem themselves before they had MAST, using combinations of lots of post-its their own designed spreadsheets, their electronic health record. So information in lots of disparate places, and then pulling those together. And now actually they feel much more in control of their caseloads. One senior mental health nurse told us that actually throughout her career she'd struggled to sleep on a Sunday night, and now she has masks. She was able to do so, knowing that she was very in control of her plans for her caseload for the week ahead.
Wow.
And many of the staff on the COVID project also talked about how it would have taken them literally hours, perhaps half a day, to assimilate the information that they were able to see in minutes by opening masks. So it really is a solution that's driven by and engages frontline staff. It's bottom up, not top down.
Fantastic. Well, it speaks for itself really, and gives you a lot of faith in the work that you're doing as well, if you needed any more kind of validation. But I guess we're kind of almost out of time, but in terms of the sort of future planning state for OHS, I mean, what's the kind of goals for you going forward over the next sort of 6, 12, 70 months?
Okay, so really there's three main focuses for us. The first is to scale MAST up, and so that more trusts benefit, and we're helped by the NIA programme with that. That's really important. The second piece is around offering to broader range of services. So we're already working on versions of MAST for complex care and older adults teams, and also integrated care teams, as I mentioned previously. So that means that more services will benefit. And then the third area is we're offering some bespoke analytics. So for example, we're involved in a project specifically looking at some analytics surrounding suicides and suicide prevention at the moment. So that means that we can respond to specific needs of specific trusts using our analytics team. And now we need to become an established organisation within the NHS. So we're kind of innovating organisation at the moment, and that will continue. But actually we need to grow so that we can provide those services more widely and have a bigger impact. And we're also supported by the University of Southampton on their Business Catalyst programme, which is helping us to become ready for that, to become that growing and more established organisation.
Wow, fantastic. Well, it seems like, there's just absolutely huge waves that are going to be made across the industry, and you're really being on the front line of that. So it's fantastic to hear about. If other people wanted to kind of, keep an eye on the progress that you're making and OHS itself, what's the best way for them to do that?
Through our website, so otsukahealthsolutions.com, through the NIA website and looking at MAST. Or simply by just following me. I'm kind of quite active on Twitter, posting about what we do and how we work. So any of those ways, or contacting me directly.
Perfect. Well, we'll put some links to those things in the summary of this podcast. But look, Caroline, it's been really, really interesting hearing about OHS and all the great work that you've been doing in such an important field. So thank you so much for setting aside the time in your really important schedule. I know being part of a startup is not necessarily quite so easy at this stage, and you've probably not got too many hours to spare in the day. So I really do appreciate it. And I look forward to seeing the progress that you're going to be going on over the next few months.
Oh, thanks for the discussion, Duncan.
No worries. Well, enjoy your weekend. I'll speak to you soon.
Yeah, thank you.
Cheers, Caroline. Bye.
Yeah.
And that's all we had time for this week then, guys. Many thanks to Caroline for taking the time to chat with me. Really interesting insight into OHS, and obviously a very important and, I suppose, underrepresented component and vertical within the healthcare sector. So really great to see that there's innovative solutions coming out such as OHS, and that they are getting the recognition through places like the NIA to, I suppose, help them grow and gain more market access to be able to provide their solutions to a wider number of people. So yeah, really interested to see where the OHS goes over the next 6, 12, 18 months, and I've put some links in the summary of this podcast for you to stay in touch and follow the progress as well. So until next time, stay well, stay safe, and yeah, we'll see you next week. Cheers.
Spilling the Beans Digital Health Podcast is aimed at members of the digital health community globally, with guests from the United Kingdom, Australia and the United States. The podcast is available through all major podcast distributors as well as on YouTube. The show is sponsored by